This segment's going to be kind of short because measuring quality is too big to cover in one part of one lecture. In fact, I think it's too big to cover in one part of one course. It really needs to be a course of its own. So I'm just going to give you some things to think about, to know about, and kind of move on with it. But I am going to give you lots of examples. There are several tools out there to measure quality. In fact, I don't even want to go into it, but I'm going to be sending you to the AHRQ website to do some recon on some of them. The big thing to know about measuring quality is that you should do it from the appropriate perspective. If you want to know the patient's experience, and that's what you're trying to measure as a quality indicator, don't look at it from the perspective of what can I, the provider, change. Look at it from the perspective of what does this healthcare consumer experience. If you're trying to look at outcomes, don't look at processes. If you're trying to look at processes, don't look at outcomes. If you're looking at outcomes as a measure, you should look at the process that leads to it. Don't get me wrong. You should look at the structure of the process and the outcome. But if your quality measure is a process measure, that's what you need to focus on. So, considering all this, there are some databases that I want you to be familiar with, or some measuring tools I want you to be familiar with. The Healthcare Effectiveness Data and Information Set, much easier known as HEDIS, is a performance measurement tool that's used by 90% of America's health plans. And while she was still working at the NCQA, Dr. Susie Harrington, who's one of my coworkers at ANA, she's now the director for the Center for Occupational and Environmental Health, COEH. She created this presentation that does a great job of describing HEDIS. I gave you a link to that. I'd like you to take a look at it. And if you want any more information about HEDIS, there's a great explanation of it on the NCQA website. The other is the CAHPS, or the Consumer Assessment of Healthcare Providers and Systems. These questionnaires ask patients about their healthcare experience, ask consumers about their healthcare experience, and frankly, I don't think they do that great a job of it, but they do a good job. At least they're asking the question. Something that should have been done years ago, they're finally doing it. They just need better psychometrics, and they need to focus on the patient experience better, in my opinion. That's my opinion. The idea behind these surveys is to gain a better understanding of what consumers want and what they're getting. That difference between I want this, I'm getting that. CAHPS includes hospitals, home care, physician providers, and others. To learn a little bit more, I've sent you to a website. There are surveys. I grabbed a copy of one of the surveys and I put it up on the module, and I want you to take a look at it. I'd really be interested in what you have to say in your blog about the survey after you've looked at this sample. It's the sample that's sent out to adult patients who have gone to a clinic or a clinician. The survey asks questions about care, but what I'd really like to know from your perspective is, does it ask the important questions about the consumer's experience, or does it ask questions about what the providers or the health plans want to hear? I have my own opinion. I think you can pretty much guess what that is. Now, there are numerous report cards out there too. I want you to take a look at some of the report cards, particularly the ones that look there. If you go to the State of Maryland website, there's the nursing home report card. There are NCQA report cards on physician quality, on other providers' quality. There are report cards on health plans through Medicaid. The one that I worked on personally was the CMS 5-star quality rating system, and I developed a statistical analytic simulation model for assessing the effectiveness of certain changes on 5-star ratings. The intent of these systems is to improve quality by directly comparing transparently one health plan against another, one health provider against another, one nursing home against another. They are disseminated by NCQA, the ones that are the report cards that I've sent you the link for. They're disseminated by the NCQA on the 15th of every month. Take a look at the links. And the quality rating system, CMS does a great job of explaining that on the link I also sent you. But again, I'd like you to look at these and see if, in your opinion, they actually are comparing things that are worth comparing. There are some biases in these, and I told CMS about the bias in the 5-star quality rating system, most particularly because the system biases towards HMOs. HMOs have the ability to control their providers directly, and because they can control their providers directly, they have the ability to improve quality much more easily than does a PPO, a POS, or a fee-for-service plan. Does that mean that fee-for-service providers, point-of-service providers, and preferred provider organizations don't do a good job? Does that mean also there are biases towards large operations? Does that mean that a physician that's practicing with one partner in a rural area is not as good as a physician that's practicing with a clinic of 18 other providers, including nurse practitioners, nurse midwives, and whomever else? No, it doesn't. It just means that the system is biased against them. And there is a lot of work in progress to improve that. Speaking of works in progress, I would hope that this last short series of lectures was somewhat better than the ones you had seen previously from me. I am trying very hard to make these more interesting and more user-friendly. And I am going to, in the future, ask your input and see if I'm doing a good enough job that I should retape the earlier lectures. Thank you very much, and I hope you have a great couple of weeks.